Hi, ICD-10 PCS uses terms known as root operation terms that identify the specific type of procedure provided to this inpatient. Let's investigate. The root operation term describes the central aspect of the procedure or service that was provided to the patient during this encounter. This term describes what the physician did for the patient, and it is that action verb, just to take you back to English class a little bit. The root operation terms available to you in the medical and surgical section of ICD-10 PCS are varied, and the terms used are different than the terms used in CPT, and they may be different than the terms used by the physician in the physician's documentation to describe what was done for the patient. However, you don't have to worry about memorizing them or getting confused because all of the definitions for these terms are right there in your ICD-10 PCS codebook. You just have to read them. But while you're here in class, take the opportunity to not only review them, but make certain you totally understand what they mean. So that way, when you're on the job, you'll know exactly which term to use. These are a few of the ICD-10 PCS root operation terms available to you in the medical and surgical section. Now, all 31 root operation terms will not be available to you on for every code. The tables will tell you what can be used with what body system, with what approach. That's why you're going to build the codes and take all of these puzzle pieces and fit them together to make that 7-character code. Some of these terms may be very familiar to you, like bypass or dilation, and then other terms may be brand new to you, like extirpation, the last word on this slide, which means to remove something solid from the body. An example of that? Like removing a kidney stone. Here are some more of those root operation terms that will be available to you here and there throughout the medical and surgical section. Again, you don't have to worry about picking out only from those that are available to you in the table section. And you don't have to worry about memorizing what they mean because the definitions are right there in the table section. But you do have to focus on understanding what they mean because you cannot ever take anything for granted. And the last few of the root operation terms provided for your use in building a code out of the medical and surgical section in ICD-10 PCS. Now, here are some examples of terms that you may be used to seeing either from CPT or from documentation and how you're going to interpret them into PCS terminology. So we know of a colonoscopy, and when we take that apart, like you learned in medical terminology class, you have the colon, which is the anatomical site, the large intestine, and then you have oscopy, which means to view. And oscopy, to view, happens to be the same definition of the ICD-10 PCS root operation term inspection, because that's what you do when you inspect, you look carefully. So that's how you will report this in ICD-10 PCS, using inspection. Let's look at another one, liver biopsy. So liver is, again, the anatomical site, and biopsy means an excision of tissue for diagnostic purposes. This tells us that because biopsy is not a root operation term in PCS, but excision is. Perfect. Here are the root operation terms that are available for you to use in the obstetrics section of ICD-10 PCS. And you'll notice that for the most part, they're different than those in medical and surgical because care of a pregnant woman is different. Some examples here of how you may need to interpret for ICD-10 PCS. So we look at cesarean section, and that is very often what you will see in the physician's documentation. But what exactly is this procedure? This is the extraction of the baby via a surgical incision, right? The doctor cuts open the mommy's belly and extracts the baby from the womb. And so what root operation term will you use for this? You got it, extraction. See, you're so smart. In vitro fertilization, what precisely is this procedure? Transfer or transplantation of a fertilized ova from a petri dish to the uterus. So you are transplanting an anatomical aspect, a fertilized ova, into an anatomical aspect, the uterus, and you get transplantation as the root operation term. Perfect. These are the root operation terms that you'll find in the placement section and the administration section. In the measuring and monitoring section, it may not surprise you that you only have 2 root operation terms, measurement, and monitoring. You have 3 in extracorporeal assistance and performance section, and several more in extracorporeal therapies. But in the osteopathic section, you only have 1 root operation term to choose from. Other procedures only has 1 root operation term, as does the chiropractic section, only 1 root operation term. And in new technology, you have 7 root operation terms to utilize to explain what was done for the patient. So, if you have any questions, and mostly if you do, so do others, please ask your instructor. Remember, getting these understandings and really knowing what this is all about is a fantastic opportunity you have being in class.